Good evening, class. My name is Nicole Coleman, and I'm going to briefly present to you on the application of the social ecological model and lead poisoning reduction among Black and African American children ages 1 through 5 living in Cleveland, Ohio. So I'm going to walk you through the history of the SEM, its development, its application to public health, and how it can be leveraged through its constructs for effective intervention planning and lead poisoning reduction. So the social ecological model, commonly known as the SEM, was first developed in the 1970s by a psychologist named Yuri Bronfenbrenner. He was interested in how a child's environment affected their development. Initially, the SEM was used to study human development, and it emphasized that behavior and outcomes are influenced not just by individual factors, but also by relationships, community, and societal structures. Over time, public health practitioners adopted the social ecological model to address health behaviors and environmental risk. Presently, the SEM is widely used in health promotion because it highlights the multiple levels of influence on health. From individual behaviors to broad policy and societal factors, the SEM uses a multi-level approach that makes it particularly suitable for addressing complex public health issues like lead poisoning, where environmental and societal factors often interact with individual behaviors to produce this undesired outcome. So, looking at my infographic, if you can see here at the SEM framework, we have 5 levels. So the first one is the individual level, and this level includes personal factors like age, nutrition, and parental knowledge about lead exposure. The second level is the interpersonal. This is relationships that influence behavior, such as family members, caregivers, and social networks. The third level is organizational, which are institutions like schools, daycares, and healthcare facilities that provide education and other resources and tools uh, regarding health and just health outcomes. So, in this case, obviously, lead poisoning. Our fourth level is community. This involves our neighborhood characteristics such as housing quality, environmental hazards, and access to healthcare. And our fifth level is the policy and societal level, which includes broader laws and regulations such as housing codes, lead poisoning policies, and public health funding. When we link these 5 levels to behavioral and environmental determinants, the SEM allows us to understand why children in certain neighborhoods in Cleveland, particularly neighborhoods that are historically disenfranchised and under-resourced, are at a higher risk of lead exposure. So we can use the SEM to promote behavior change through several different ways. At the individual level, the SEM allows us to educate parents about safe practices such as frequent hand washing and preventing children from chewing on lead contaminated surfaces. The number one cause in lead poisoning in children under the age of 5 is occupying or residing in homes that were built prior to 1978, before a lot of the laws that we have today really having stricter guidelines and codes on the level of lead in homes. Prior to 1978, there wasn't as many regulations. So children that are living in homes built before this year, they are exposed to contaminated paint that has large numbers of lead content in it. And children under the age of 5, they're also very explorative, they're very curious. So they also have a lot of hand to mouth context. So they're constantly touching things and then touching their mouths. So a lot of times they end up ingesting paint chips that have lead in them. And another thing that contributes to lead poisoning among this population is the occupation of their caregivers or their parents. So a lot of times parents or caregivers, they're working in environments where they are unknowingly exposed to lead. So it's coming home with them on their clothes, little particles, it's on their hands. They're not washing their hands when they come through the door before touching their children. And all of that influences, the amount of lead that we're seeing in the blood levels of this population. And honestly, there's really no such thing as a healthy level of lead in the blood. There should be none. But these are some of the ways that this does end up becoming a public health problem for the specific population. Um, like I said, the interpersonal level, is community health workers that can support families and provide reminders and resources for screenings and also reinforce safe behaviors. At the organizational level, healthcare clinics can implement routine lead screenings and connect families to resources in the event that their child does have lead poisoning. At the community level, we can advocate for neighborhood-wide poisoning reduction programs and improve housing quality. And at the policy level, we can support stricter enforcement of housing regulations and increased funding for lead removal programs. And this can create systemic change. When we target multiple levels, interventions are more likely to be sustainable and effective because they don't solely rely on individual behavior change, but they bring people together and they make it a joint effort to change this behavior. The pros and cons of the SEM, just like any other behavior theory model, it does have its advantages as well as its limitations. Some of the pros of the SEM include the fact that it uses a holistic approach by considering multiple levels of influence. Like I mentioned above, there's those five levels, which is the individual, interpersonal, organizational, community, and policy level. So because it does incorporate those different levels, we're able to evaluate health behaviors from a more uh, intricate standpoint. So we're not just relying on just two things. It's not black and white. There's a lot of nuance to it. And a lot of times when we're dealing with behaviors, it is very nuanced. It's very specific to an individual or to a population. Another pro of the SEM is it helps us design interventions that are multifaceted and sustainable. Lastly, it is flexible and adaptable to various health issues and populations. Some of its drawbacks include the complexity of it because it is so intricate and it does pull from so many different levels. It is resource intensive, and addressing each one of those levels does require significant funding, personnel, and time. Measuring the outcomes across multiple levels can be challenging, and it's particularly challenging for the implementation of community and policy changes. Lastly, when we're dealing with communities such as Cleveland, where there is a historic pattern of housing and systemic inequalities, this can limit how quickly policy level interventions can actually go into effect. However, in light of these challenges, I still believe that the SEM provides a strong framework for planning interventions that can address both immediate risk and long-term structural factors that influence and affect lead poisoning exposure among this population. So, in summary, the SEM helps us understand the complexities between individual, social, and structural factors and how these things work in conjunction and contribute to lead poisoning in Black and African American children in Cleveland. When we apply the SEM, public health interventions can be more comprehensive, equitable, and sustainable. We're not just addressing immediate behavioral factors, but we're getting to the root and we're looking at things like environmental factors and policy factors and how these things work together to perpetuate health disparities. Thank you guys for watching. I hope this presentation was informative and provided a better understanding of how the SEM can be used to guide intervention planning strategies in reducing lead poisoning in vulnerable populations. Have a great night.